Welcome. My name is Tony Shawcross. This is a presentation on the topic of projection in psychedelic assisted therapy. Some members of the Colorado Psychedelic Practitioners Cohort, formerly called the Colorado Psychedelic Facilitators Cohort, will be watching this as part of their preparation for doing psychedelic assisted therapy. The Colorado Psychedelic Practitioners Cohort is a peer-led group of over 500 psychedelic therapists, facilitators, guides, aspiring psychedelic professionals who are committed to optimizing and maximizing the mental health benefits of the psychedelic medicines, plant medicines that were legalized in Colorado. Proposition 122 2 years ago, back in 2022. Proposition 122 legalized psilocybin, DMT, ibogaine, and mescaline, which joined THC, which was marijuana, which was already being used in psychedelic assisted therapy, ketamine, which is also used in psychedelic assisted therapy. So we're going to be talking about a broad range of psychedelic assisted therapy and psychedelic facilitation and some of the pitfalls of projection that apply to all of these forms of psychedelic facilitation. So welcome, and we may have a peer-led discussion at the end. We will have some exercises for people to try on at the end. I'm going to begin with a couple of quotes. "We don't see the world as it is, we see it as we are." It's from Anais Nin. And from Dick Schwartz, "How we think about and relate to the inhabitants of our inner mind translates directly into how we think about and relate to the people we encounter." That's from his book, No Bad Parts, the developer of internal family systems. And I do want to also say, when we're talking about psychedelic facilitation, psychedelic assisted therapy, we might be talking about very distinct, broad things. Some people have only had one experience with, a trip sitter, and that's what they think of. But, there's kind of a whole spectrum from trip sitting, which is usually like high dose one-on-one sessions where it's really just about the relationship between a participant and the medicine itself. There's no real like talk therapy usually that's happening. Although there are trainings like the Zendo project that train you in how to best support people when they come up against challenging situations as a trip sitter. Then there's ceremonial, which is usually one or two guides or shamans leading a group, taking full responsibility for a set and setting, usually again like high dose. And then shamans can be very directive, or they can be very passive, and again just kind of honoring that relationship between participants and the medicine. And there's group clinical facilitation, which again can be a range of how directive it is, usually again pretty high dose. Individual clinical facilitation, where it's more like one-on-one or even two therapists on one participant. And then there's like psycholytic therapy, which are usually more like low dose, more kind of talk therapy happening, where people are actually processing, and it's not just about intention setting and integration. It's actually like using the um, effects of the psychedelics to kind of mute the default mode network, kind of lower some of the defenses to have like effective psychotherapy sessions, usually using modalities that work really well with psychedelics, like internal family systems, somatic experiencing, Gestalt, EMDR. So before we get into this, I want to make sure that we have kind of a definition of these words that we're using. So there's a lot of definitions of the word projection or transference in therapy. But the primary distinction between projection, transference, and therapy is that projection is when either a client or a therapist just mistakes their own thought, a perspective, a feeling, a motivation, an emotion as coming from the other. It happens all the time. We all the time have thoughts or perspectives or motivations that we attribute to someone else, thinking that their brain works the way our brains do. I think I'm a little bit on the neurodivergent spectrum. I think the more neurodivergent you are, probably the more likely you are to mistake your own thoughts and motivations and perspectives for others. Not understand that other people's minds often work very different from our own. Transference, unlike projection, is specifically when a client relates to a therapist as a person from their past and places the therapist into a role of a past relationship or a past encounter. Then there's also countertransference, which is when a therapist relates to a client as a person from their past and places the client into this role of a past relationship or encounter. So it's just important to understand these words. For the most part, we're going to be talking specifically about projection, which is just a broad catch-all for any time that you're mistaking your own thought as coming from another. And some people, like some of those quotes we had before, suggest that we're always projecting, that that's like the human condition, that there's no way out of it. And that's part of what I'm going to be talking about today. So consider for a minute that there are no windows from the outside world into your mind. Everything that we see and hear is translated from sensory stimuli into electrical impulses that are entirely distinct from the stimuli that they come from. So you're looking at me in the screen, you're hearing me talk. Your eyes, your optic nerve is translating what you're seeing into these electrical impulses. Your ears are translating that auditory signals into electrical impulses, going into your brain and completely recreating these images from scratch. No windows into your mind. And they're recompiled in our minds into pictures or messages and ideas that we think accurately represent the world outside, but they're invented by our minds. They're invented as approximations. And in some ways, our mind isn't even designed to approximate things accurately. The design of the mind is really to expedite cognition, to filter out what is important and not important, rely on memories sparked by present experience rather than just everything that's coming from your present experience. There have been brain scans that show that when you're concentrating even on something visual, only a small percentage of the brain activity is happening in the visual cortex. A lot of it is coming from memory. So I have a 4-year-old son, and the first time that he saw like a bug crawling across concrete, he stared at it for a long time and he understood it, or kind of grokked it and comprehended this bug in a way that literally he will never understand it again. Unless maybe he does psychedelics as an adult. But our waking experience is really circumvented by a mind that is designed to categorize and compare and relate the present through past memories and filter everything through past memories and past categories. Yeah, so never again will he just like really just stare at a bug crawling across the ground for the first time, like comprehending that there is this living thing that does this in this way. It's always going to be relating to past experiences of other things moving or other animals and insects and that time when he got bit, whatever. Yeah, that's what our mind is designed to do, to quickly categorize, to keep us safe, not to accurately represent the world outside. And this topic of how much we're projecting versus perceiving has been explored for millennia, for as long as humans have been pondering things. Descartes has this very famous quote, "I think, therefore I am." And when you read the full publication that comes from, it's really just him exploring how that statement, "I think, therefore I am," there's something here thinking. He was saying that's really the only thing he could be certain of. It's the only truth he could really find. He poked holes in doubt in literally everything he could experience. He thinks of, how he thought dreams were real, or how he saw things in the desert that weren't real, and optical illusions of different types. And he says, yeah, anything beyond knowing that there's something here thinking is conjecture. It's not really something we can be fully certain of. And Einstein has this amazing quote, which I find so like humbling. I'm going to read it out loud. Please read the words as I'm reading it. Concepts, which he means all understanding of the world, all understanding of the universe, all concepts are free creations of the human mind. And they are not, however it may seem, uniquely determined by the external world. He's just saying all of our understanding of the world is distinct from the world, the universe. In our endeavor to understand reality, we are like a man trying to understand the mechanism of a closed watch. He sees the face and the moving hands, he even hears its ticking, but he has no way of opening the case. If he's ingenious, he may form some picture of a mechanism which could be responsible for all the things he observes, but he may never be quite sure his picture is the only one which could explain the observations. He will never be able to compare his picture with the real mechanism, and he cannot even imagine the possibility or the meaning of such a comparison. Yeah, this is someone who had enormous intelligence and incredible diligence to try and understand how the universe works. And it's such just like a wise place for him to have gotten to just say, like, we don't know anything. Like E equals MC squared is not how the world works. It's different. It's an important, like piece of understanding, but it's still very distinct from the world. So the danger of certainty. So a therapist can never really be 100% certain that their understanding of a client is not a projection of their own psyche and their own subconscious mind. Also, therapy clients are incredibly suggestible, especially on psychedelics. So even if an interpretation was maybe, 50% perception and 50% projection, a client is prone to believe that it's 100% perception. They're so suggestible, which is true in normal therapy, but far more true in psychedelic assisted therapy. And then second, the less that you are analyzing and explaining things to your client, the more you can be empowering them to analyze and interpret things themselves. It's especially important for newer therapists, but no matter how seasoned you are, I'm here to argue that it's best to avoid analysis, minimize suggesting your interpretations, and focus on empowering your clients to notice, interpret, remember, make connections on their own. I'm going to talk a little bit about Brad Blanton. Dr. Brad Blanton was, I had no interest in psychotherapy really, besides my own mother. He was the first psychologist that kind of taught me about this work as I filmed some of his retreats and shops. I was so impressed with his ability to see blind spots and to analyze and interpret and see connections that I just couldn't see. And I was so grateful for some of the insights he gave me that when I was later trained by him to lead workshops, I really thought that was also my job. And I spent so much time in my head just analyzing and like thinking hard to try and draw conclusions and like enlighten clients about something that some blind spot they might not be seeing, some way that they're sabotaging themselves, some way that they aren't connecting, a manifestation of repeating struggles in their life, that sort of thing. I didn't see how I was driven, not really by my desire to just serve clients and their happiness, but by a desire to be impressive like Brad was. And my admiration for him, I later learned, didn't really serve me well in me learning to accurately self-reflect. And yeah, so I've been continuing with that training and also the other programs that I've worked through. I really am drawn towards programs that are focused not on not setting up any kind of dependence between a therapist and a client, but on just like continuing empowering clients to do this work themselves and get to a place where they, don't necessarily even need ongoing therapy. So minimizing projection in psychedelic assisted therapy, I want to just posit that there is potential danger and harm in assuming that something you are really projecting is a perception and mistaking a projection for a perception. There's never any harm in the other direction, assuming or owning that your perception may be just a projection. Really, there's no downside. Even if you're spot on 100% accurate, you just say like, I can't be sure I'm not just projecting this because it's true of me, or maybe true of me, but I'm, perceiving this. There's really no downside to presenting your interpretations as a projection besides potentially to your ego. So In my training, both with Gestalt and somatic experiencing, I've learned that one of the best ways to minimize this risk of projection is that your first job is just noticing your own body, not being in your head, not analyzing, just noticing your own body. When you have a reaction to something you're experiencing with a client and you feel it in your body, it's the best clue that it is stirring up something in your past, in your subconscious, in your psyche. It's one of the most common dissociative behaviors for people to attribute their own sensations to others. You feel something in your body that you don't want to feel, you don't want to own, and you, yeah, project it onto others, or think you're psychic, or think you're overly empathic. Some psychics and empaths are some of the least self-aware people that I know, because they're in this practice of assuming that something that is created in them is coming from someone else. So your first job is noticing your own body. And then your second job is to open your eyes and your ears and to just observe your client, grounded in your senses, your eyes and your ears. The more I practice this, the more I recognize that when I'm in my head, when I'm thinking and analyzing and drawing connections, and I usually feel more disconnected from the client. Whereas when I ground myself in my body and then just watching and listening to my client, I feel way more attuned to the client. And then your third job is just supporting your client and noticing the first two. When observing a client, you want to call to their attention their own body sensations, which they may be dissociating from, their own nonverbal communication, which they may not even be aware of. It empowers them to notice and assess, whereas your analysis or your insight as a therapist just reinforces a power dynamic and introduces dependence. Gestalt, somatic experiencing emphasize this framework and discourage overly analytical or interpretive and directive therapy. And remember that from a neurolinguistics programming perspective, questions are suggestions. If you say, "Are you feeling cold?" there is an implicit suggestion that they might be cold. And suggestions like, "Do you want to switch off of your your SSRI onto microdosing ketamine or something?" Suggestions are often commands. I think it would be a good idea to do this, or maybe it'd be a good idea to do this. These from an NLP perspective are commands, especially in a situation where you have a power dynamic like this. So one way to minimize that is when you're asking a question or making a suggestion, to offer up the opposite as well. So, are you cold or do you feel comfortable? Do you want a blanket, or are you plenty warm? Offering both of those things so that both of the suggestions are implied. And same thing when you're making a suggestion, like trying to offer up both things. It's a good little tactic to use to minimize your directiveness with a client and empower them to make their own decisions, honoring the free will of your client. So there's a little group exercise we're going to close with. It's called "I'm Feeling, I'm Seeing." So it's just a practice. We do it in radical honesty and Gestalt sometimes as a paired meditation, where two people sit across from each other, look at each other, and just share these two things back and forth. So I'm going to do it as I sit here, and I encourage you to do it with me too. I'm feeling, and you don't want to do an analysis of a feeling. You want to do an actual sensation. So instead of like, "I'm feeling tired," you'd say like, "I'm feeling some pressure and droopiness behind my eyes," or "I'm feeling a yawn." So I feel dry mouth, and I'm seeing a small image of my face on the screen. I feel an itch on my ear, and I'm seeing the word "exercise" on the screen. I feel myself breathe through my nose, and my voice and breath come out my mouth, and I'm seeing the word "exercise" on the screen. I feel myself kind of rocking back and forth, and I'm seeing my face. So try and do this a little bit, either with someone that you're sitting with, or right now to the screen to me. I'm going to give you just a few moments See how it feels to shift from this way that we almost always are, which is in our minds, to being grounded in our sensations and our senses. Take a moment. I'm feeling, I'm seeing. I'm feeling, I'm seeing. I'm feeling, I'm seeing. I encourage you to do that more and more. For me, the first time I did an exercise like this was the first time I actually felt I didn't have a meditation practice. It was really the first time I felt my mind really quiet and realized the benefits of getting out of my head and into my body and senses. So I'm going to close after that with this quote from Charles Eisenstein and kind of a larger concept that really was introduced to me by internal family systems, but spoke to an idea that I think has always been there in me, which is there are so many wars and crusades, so many calls to overcome an enemy by force. So it is that the inner devastation of the Western psyche has come to match identically the outer devastation the Western psyche has wreaked upon the planet. So, yeah, I mean, this is a quote actually from No Bad Parts and Dick Schwartz quoting Charles Eisenstein and talking about how we have these shadows, we have these parts of our psyche, we have these exiled parts that are adaptations that our 3, 4, 5, 6, 7, 8-year-old brain made to cope with and respond to and protect ourselves from some kind of pain or trauma that we endured. And then most of us go through so much of our lives avoiding that piece or trying to use like discipline or shame or avoidance to kind of suppress those parts. And we often then also like project them on other people and push those people away. And, there is this alternative model of accepting and supporting and understanding these parts. And when we do that, we not only have less risk of harming and misleading clients in our work in psychedelic assisted therapy or psychedelic facilitation, we also shift to a more accepting and supportive approach to our society, our community, our universe. So this idea, I think, is super useful in therapy and facilitation, but in my experience, it has some benefits that reach way beyond that. So we're going to now have the video will end, but we're going to have a little group discussion with members of the Colorado Psychedelic Practitioners Cohort, talk about these concepts. And I encourage you to check out some of our events at meetup.com/psychedelics. Please follow us on Instagram. We'll have some links to some of these things here in the video. But thank you for joining us for projection in psychedelic assisted therapy. My name is Tony Shawcross, and this is a presentation of the Colorado Psychedelic Practitioners Cohort. Thank you.